So my name is Ganbold. I'm from Mongolia, and my background is anesthesiologist, and I work for Mongolian National University of Medical Science as a lecturer for emergency medicine and anesthesia. So I am also the member of Lancet Commission. I'm a commissioner, and we work quite a lot on global surgery. The surgical care in Mongolia can play as a good model for quite many countries in low income countries, as also low middle income countries. So even we have a large territory in a sparsely populated country, we were able to build up the surgical functioning hospital in province centers, and those are more than 20 and very equivalently distributed in all over the Mongolian land. So, and even there are so long distance to overcome to the surgical access, it is still solving the problem with Mongolian approach. We calculated the population who reach the surgical access, surgical or operating room in 2 hours. Those are more than 80% in Mongolia. There are still 20% to cover in the next couple of decades. So now there are 83 around percent, and we trying to increase this percentage more than 90 and reach the numbers where like in a Western country. Even percentage-wise, the 20% of the population sounds quite good in compared to the world average. But those 20% of people who live in a rural area and who follow the nomadic lifestyle, this is the special part of Mongolia. This is the Mongolian most valued heritage. When we think about the Africa, we think this the nature, green continent. But there are in other countries, in every country they are wildlife things and heritages and lifestyles. The Mongolia, the nomads people are most extraordinary lifestyle or extraordinary heritage in Mongolia. Actually, those 20% feed us Mongolia, the rest of the Mongolians, because in winter time we store, for example, meat, and only my relatives send over when it's a long and very cold winter in Mongolia, and then at the beginning of the winter they send us to UB the high quality meat, and only with this meat and with this pet we can overcome the winter. And they are not only feed us, but they kept the Mongolian tradition and the culture, and also style of living with the nature. That's why we value this part of this population and this kind of life, and everyone trying to save this life in the future in a changing world. That's why those 20% of population who live in a far away from each of these operating or surgical facilities have to have a right to get a quality surgical service in a reasonable time. So that's why, as other countries, we wanted to increase the number of the operating room in a rural and in a distance area in Mongolia. And we're trying to open new operating rooms in small hospitals and equip them and train the local doctors, and also build up the safe surgery place. So, meantime, it is definite that the surgical and orthopedic care, as well as obstetric care, is a primary service. And those people who live in a far away in a rural condition, they have to have a right, also the right and availability, have to have ability to reach the surgical care in 2 hours to drive. So that's why we, means the people who love or work for global surgery in Mongolia, we go a lot of outside of this capital city, and we build up a team that most members of lectures of Mongolia National University Medical Science, surgeons, anesthesiologists, as well as obstetricians. And we work in these smaller hospitals. We help them to work as surgical function. We assess the condition, if it is safe or available to do the simple operations, essential bulldozers, and we work with them together. And it is the best approach to train the local doctors, and we also help as much we can to establish the infrastructures. And when we work together in this local area, in this small hospital, we do as much as possible operations together with the local surgeons, and this usually buys the trust of the local populations. And then there are a lot of needs to do the essential operations on the place, because the land is so distant and so huge. If someone wants to come to UB to get a surgical care, it takes so long and it takes so much money, as usual as other countries. So when we go out as a team, we face exactly this essential surgical cases in a countryside. There are also a lot of pediatric cases, pediatric urologic and pediatric surgical. We do a lot also for children. That's also a special part. Additionally, there's the usual essential list. So we plan to aid the numbers of the surgically functioning small rural hospitals. We call it district hospital. In Mongolia, we call it interim hospital. When the number of this operating rooms and functionally working rural hospital, then one of the Lancet indicators goal will cover and will increase. It means then percentage of the population who are able to reach the operating facilities inside in 2 hours, this percentage will increase. And that's why we, right now we have around 10 till 12 functioning places. We're visiting them quite regularly, and we will try to increase this 20 centers in 2020, and we will increase the numbers up to 30 in 2030. Then the percentage will remarkably will increase. So what else? So we are a team. The Mongolian team in a global surgery. We work fairly hard in our Mongolian land, because Mongolia is also part of global surgery. The people in a surgery and in anesthesia, we are eager to contribute in a global surgery, as first in our country, in Mongolia, in a rural area, and we are also trying to work to reach the Mongolian rural area. Then also later on to reach also the neighboring countries and the Central Asian region. And we are trying to deliver and to share our experience in a ISC, emergency essential surgical care project experience with other countries where there are this project is not yet started or started recently. For example, we reached also Laos several times, and we talked with the stakeholders or Minister of Health in Laos, and we also was able to visit the friendship hospital which the Mongolian government built up many years ago. And we have a plan to reach this hospital and to build up or help and to work with them together in a global surgery in Laos and in other countries. So why the surgery is quite well developed in Mongolia? Because of the sustainable policy, and because we had a sustainable partnership with surgeons from Western countries. Those are surgical team, SST, Swiss surgical team from Switzerland. They came more than 20 years and reached a lot. And then the Swanson Family Foundation, Utah University, and also the Australian team, like Australian Associate of Anesthesiologists, people from PTC, Primary Trauma Care, people from Initial Emergency Course, and also people from ATLS, from American College of Surgeons. So we work with those partners more than 20 years on a development in surgery in Mongolia, and we did a difference. So one of the key to develop and progress global surgery is a partnership and international collaboration in a sustainable basis, and to have a good team from a local country as well as a good team from the outside, and those teams works together in a strong understanding. And when we join our effort in the global surgery, then we reach the unreachable.